Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession. Welcome back to another week of the RD2BE podcast. I'm your host, Jenna, and this week I'm super excited to feature a type of dietitian that we have seen become a lot more popular as an interest towards a career path for aspiring RDs. So I'm sitting down with Colleen Sloan. She's a pediatric physician assistant and an RDN, and she's also the podcast host of Exam Room Nutrition, which is a platform for educating clinicians on nutrition for patients. And so we're super excited to have her on to talk more about what she does as a PA, what she's done as an RDN, how those have merged together, and just talk about how the importance of integrating nutrition more into the healthcare field and with all clinicians. So Colleen, thank you so much for joining us and taking the time to talk about your experiences.
Jenna, thank you so much for having me. It's my favorite topic. I love nutrition. I love medicine. So it's the perfect marriage between the two. So I can't wait to discuss these things with you today.
Yes, I'm so excited. And so the first thing that I want to ask is just your background and your journey of entering the dietetics field, because you started in dietetics and then how that transitioned into becoming a PA.
Yeah, absolutely. So, I grew up an athlete my entire life. I was in sports. So I was always really fascinated by nutrition and health in general. And then when it comes to choose a degree, when you're a grown up, you're like, what do I want to do with my life? And so it was kind of a natural choice. However, I thought I was going to be pre-med. And so like a lot of good pre-med students, we choose biology as our major. And that sounded so boring to me. And I just couldn't bring myself to do it. And I happened to be touring the college campus with my mom, who actually worked on a college campus as a sales rep. And I happened to walk into the nutrition department by chance, and I didn't even know what a dietitian was. I didn't know nutrition was a degree that you can get. And I literally left the FIU campus, Florida International University. And I was like, oh, this is perfect. This is exactly what I want to do. And so I finished my 4 years at FIU. I graduated with a bachelor's in nutrition science. And I was happy. That is exactly what I wanted to do. And I immediately started in my career and in my field, and I loved it. I was so fulfilled. I love with nutrition that you're not stuck in one area. You can kind of recreate yourself. And so most jobs are really easy to get out of college are clinical. So in the hospital. So I worked in the hospital base for a couple of years. And this is, again, the beautiful thing about dietetics is if you're kind of like, not that you're bored of it, but you want to change, you want to do something different, you can. And so that's when I kind of branched out and I was like, all right, I think I want to open my own business. So I got an LLC, I created my own private practice, and I worked with weight management and diabetes and loved that, but it was a little frustrating. It wasn't really my passion. I got very burnt out very quickly with patients not listening and, not being successful and then blaming me. And it just got really frustrating. And then I moved into the pediatric world. And so I'm still a dietitian now. This is 4 to 5 years into my career. And I got a killer job with Lucille Bessler, who was a past president of the Academy. And she's just been a dietitian for a very long time. So she happened to be my friend and my mentor. And I worked with her at Joe DiMaggio Children's Hospital in their outpatient clinic. And so I ran the cystic fibrosis clinic, the cleft and craniofacial clinic, and the dialysis clinic. And I fell madly in love with pediatrics. And also, too, at that point, felt like I had so much more to give to my patients besides just their tube feeding orders, or specifically for cystic fibrosis, their enzyme dosing and the extra sodium that they need to be having. Although I was doing a lot on the team, I wanted more, and I felt like I could do so much more for my patients. I had more to give them. So I just happened to say, you know what, I think I'm going to apply to PA school. And at that time, it wasn't as popular as it is now. It was, popular. There have been PAs for a very long time. But so the ability to meet PAs and meet nurse practitioners and meet doctors and work with them on a team as a dietitian is so invaluable. Don't take that for granted. If you're a dietitian and you're kind of like on the fence of what to do next, go talk to people. and then just introduce yourself. Hey, I'm so-and-so, I'm a dietitian, but I'm thinking about X, Y, and Z, whether it's going to be a PA, nurse practitioner, apply to medical school, or open your own private practice. Sit down and talk with someone. I promise you, most people would love to share their story in 2 to 3 minutes. And so that's what I did when I kind of had that itch to change and itch to do something different. Every PA that sat down next to me in the hospital, I'm like, hey, I'm a dietitian, but I'm thinking about going to PA school. What do you love about your job? Really quickly, because they're busy. I get it. And it sold me because every single one was like, I love what I do. Every single one. I also chose to become a PA because I'm also a mom. I had a child in college. And so I really didn't have the time to go to medical school. I didn't want to be in school again for 10 more years and be done, when my daughter was like 10. So I thought PA was a really great opportunity to be in the field that I wanted to be in. And so I applied to only 2 schools in South Florida. I didn't want to move. So I applied and got into Nova Southeastern University in Davie, Florida. And so that was in 2015. And I have been a PA in pediatrics ever since. So 2017, I graduated PA school, and I have worked in pediatrics ever since. I know I don't want to work with adults. I will never work in the adult medicine world. I will always be in peds. Right now, I'm in general peds for the last 7 years. I love it. I might switch or specialize eventually, but not in the foreseeable future.
Awesome. Yeah. And I think it's great how you literally went from start to finish. And I think it's so funny how you mentioned Lucille, because we've had her on the podcast before talking about nonprofits and all the work that she does as well in pediatrics. So it's very cool to have that small world sense in dietetics. But I love also how whenever you talked about your transition from dietetics to becoming a physician assistant, it wasn't like you enjoyed dietetics. It wasn't that you didn't like what you did. You love nutrition. And it sounds like you didn't really regret the transition or the experiences that you had to lead you to where you came, which I think is really great. And as far as once you got your PA credential and you also still had your RD credential, what did it kind of look like once you had both of those at the same time? And as far in like, I'm talking like good, the bad, not bad, but just everything that you've experienced since having both credentials and what it's looked like for you as far as your career.
So really being dual credentialed in anything, you gain a lot of respect. In PA school, everyone looked up to me. I actually taught the nutrition section of my PA class because you have just this wealth of knowledge. Being a dietitian, you take all of the sciences. You know the majority of the medical conditions that you are learning about in PA school. It's just not as in depth and not the medical treatment. So you have such a leg up in medicine to have a background in nutrition. So that those two are so well supported and they support each other so beautifully. But even any credential is helpful for advancing yourself. People look at you differently, especially if you have a psychology major. I've had a lot of friends who are also lactation consultants because you bring that extra experience, you bring that extra knowledge towards you. Now, specifically with being a dietitian and a PA, at first, it is a huge learning curve being a PA. You're kind of learning what medical students learn in 4 years, you do it in 2, and then you're just thrown out there and hope you have a really good mentor that can help you along the way. So that's a really big challenge out of PA school. If you talk to any PA student, they're like, it's a lot of information. And then your first year actually working and seeing patients is a big learning curve. So I really didn't do much with my dietitian degree specifically. Like I wasn't taking private clients. I mean, I would talk to patients about nutrition, but you do have to learn how to navigate the two. Patients are there to see you for their medical care. And what I have successfully kind of perfected over the last several years is how to discuss nutrition during every checkup. And that's really my passion, is to teach clinicians how they can do this. Whereas I understand that we have limited time, but that's not an excuse. I think nutrition should be discussed, whether you have a 5-minute sick visit or a 10 to 30-minute well check. I think it's an important point that all patients need help and direction on, respectfully and compassionately. But I think a lot of people aren't doing that because they just either don't have the knowledge or don't have or have the excuse of time. And I'm so passionate about bringing nutrition into the exam room because people are told inappropriate and inaccurate things, or they're seeing such harmful advice on social media. And if the clinician isn't correcting that or isn't, giving them the appropriate recommendation or appropriate guideline, it can lead that patient down a really unhealthy pathway. And so I think we as providers have that responsibility to provide accurate nutrition information. And I think, any dietitian who's listening can attest for the frustrating aspect of being a dietitian when it comes to reimbursement and respect among the community. A lot of even medical students and residents don't even know what a dietitian is until they see one in the hospital. And then sometimes they think they're just like a lunch lady. And so I think just getting education out there of like, no, these are all the things that dietitians can do. But also a frustrating thing with the dietitian is reimbursement, right? So you have so much to do and so much to say that in so many ways you can help patients, but their insurance doesn't cover it. And then they don't want to see you because they maybe don't have the funds or don't see the value in what you can provide. And that's a really frustrating piece when you work as a dietitian, especially in private practice. But as a PA, it's a little bit different. And there is sort of this unspoken hierarchy in medicine, like doctors, like that degree, the doctor is like worship, like you think that they're right in everything, or patients view them as like they're correct in everything they say is like end all be all, which isn't always necessarily true. And then you've kind of got the PAs, nurse practitioners. And so we do have a little bit more clout and respect when it comes to the things that we tell our patients and the things that we say. So I find that I am even more respected as a PA and a dietitian than just being a PA or just being a dietitian. Having those dual degrees opens up so many more opportunities, and so many people just respect what you have to tell them.
Yeah, and I'm glad that you emphasized that it wasn't the fact that you were a PA that all the respect was given. It was like you had both, because you can be respected as a dietitian, you can be respected in either role. It's mainly just the power that having both can have. And as far as students that may be interested in pursuing this path, like, are there any specific the only thing that can come into my mind is like personality type, archetype, or types of students or interests or career interests that an aspiring RD has that you would recommend them do this path, or just any insights that you have given that you've experienced doing both?
A lot of PAs have very similar personalities. We are usually pretty laid back. If you kind of take a look at the overall picture of like, okay, what do doctors look like? PAs and nurse practitioners, right? That's kind of like the three levels of provider that you can go toward. PAs are usually kind of like pretty chill, like really easy to approach. I find them very nice, very open to discuss things. And I'm not saying that the other providers aren't, but each niche, shall we call it usually has that type of personality. And so I think if you have that kind of, you're willing to learn, you really want to learn nature, but you also want to do more than just talk about nutrition, it might be a great option for you. However, if you're in the pursuit of a dietitian degree, I would highly recommend you don't just stop when you get your degree and then apply to PA school. I would highly recommend you go for that RD credential, work for maybe a year at least, and then apply to PA school. Because yes, that degree is helpful. Yes, you're going to gain knowledge. Yes, you have a little bit of clout, but you don't have that credential behind your name. And honestly, that credential is what gives you that respect, that authority. Because you can get a degree in psychology and you can get a degree in biology, and they are kind of all equivalent at the end of the day. But slap on the RDN behind your name, you have so much more. You're on a whole nother level than people who just got their bachelor's in nutrition. And so I would, if you're like, oh, I want to be a PA, but you're getting your undergrad in nutrition, I cannot stress the importance enough of getting that credential. You will not waste any more time, I promise you. The other thing that being a dietitian lends you toward, if you are thinking about applying to PA school, is clinical hours. A lot of people don't think about that, but PA school is extremely competitive right now. I think it's only like a 6 to 7% acceptance rate right now, which is unbelievable. So you have to shine like the sun in order to get in. And I got in my first year of applying, and I really truly think it's because I was a dietitian for 5 years and I had so much clinical experience that they were just like, yes. I mean, not only do you get the clinical hours, which are hard to find right now, right? Post COVID, a lot of practices are not allowing inpatient shadowing. They're busy, we're short staffed, so they don't want to have students following them around. And so it's really, really hard to get shadowing hours. So if you were to just graduate with a bachelor's degree and you apply to PA school, where are you getting those hours? Also, too, a lot of people are scribes or MAs, which is great experience, but you're not standing out if you're doing that. You're just another one who's applying to PA school. So getting those clinical hours as a dietitian is amazing. Plus, it also allows you to meet other people. Like I was saying in the beginning, you're in the hospital, you're literally surrounded by people who you want to be like and who you can put on your application of like, oh yeah, I had a conversation with Becky, the orthopedic PA, and I had a conversation with Dr. Jose, who's a gastroenterologist, and I know I want to be a PA because of those conversations. And so that makes you such a well-rounded applicant, and you have so much experience. Not only that, but you come into your application as a professional. You're not coming in as a college grad. You're coming in and they're viewing you as, oh, wow, you are respectable because you can manage patients. You have great communication skills because you educate patients, right? So you have this level of knowledge and experience in being a dietitian and working as a dietitian that programs will respect astronomically. So that is, if you hear nothing from what I've suggested today, is don't stop at your bachelor's degree in nutrition. Push through, get that master's, sit for the boards, work for at least a year, because it's going to take about a year anyways to apply to PA school. So you may as well get some rock solid experience under your belt so you can really plump up your application.
Mm-hmm. And I'm so glad that you mentioned, like, because I feel like there's a lot of miscommunication or misconceptions with the value of a credential where they're like, oh, I just need to keep adding letters to the back of my name and then I'll be okay. I'm glad that you're emphasizing the experience that you are able to get behind the credential, and that the credential, it does represent more respect, more clout, and just having a more solidified position in a clinical workspace. But I'm very glad that you're hammering home the experience that it gives you and what doors it opens, because with dietetics, we want to get like all these credentials and all these like special things at the back of our name, where it's really, yes, those are greatly important for increasing respect only if you know that you'll use that credential, or only if you'll use it, and knowing that if you get that PA credential, it is because you will use it, and it is because you want to work in that space, and it's because you want to be a PA. Because yes, it is hard to have, for certain hospitals for sure, to have dietitians feel heard, feel respected, feel like they are part of the group, but it's also knowing your why and making sure that you definitely want to do it. And I remember you mentioned how you had your daughter while in college. Did you have her while in undergrad or in your master's?
Yeah, I actually had her in undergrad. I was in my third year of college. And so for any moms who are listening, or second career individuals, like, it is totally doable to get a bachelor's degree, to get a master's degree, to go to PA school. Heck, I had medical students at Nova that were moms and were pregnant. And it's like, women, sorry guys, I'm just going to talk to the women for a second. We're amazing and we can do incredible things. And when you set your mind to something, you can do it. So don't consider age, ethnicity, social status, or parenthood as a blockade to what you can do for your life. My daughter saw me literally like cry over homework assignments, and she watched me not only from college to working as a dietitian to then thinking like, you know what, I have more to give. I'm not done yet. I want to do more. And she watched me on that journey, and the life skills and the character quality that she will take from watching my journey are invaluable. And so don't write yourself off because you're a mom or because you're a parent or a dad or whatever. You can totally do it. It's really, really hard. PA school is, I mean, college, all of it is super hard, but it's doable and it's so worth it.
Yeah, because I just wanted to, whenever you mentioned that, that is a big barrier that we hear from a lot of people, just either getting the RD credential with that new master's degree requirement and feeling like we're not getting paid enough anyways with the lack of reimbursement. And so there's that idea where it's like, well, you have to work so hard to get this credential or work so hard to get this. How will I have any time to also raise a family, to be a mom, to be a parent? And like, I'm so glad that you brought that message home. But do you have any like specific advice or things that you did to kind of help balance raising? And I know that if it's too personal or things like that, that's totally fine. But it's more so just if you have any advice towards finding that balance and making sure, for example, your daughter wasn't like lacking that presence at home while you also weren't lacking what you needed to finish PA school, how you found that balance through it all. Because yeah, it's definitely, I'm glad that you emphasize that it's doable, but also that it's hard, but also knowing like the proper steps that someone could take if they're in that position as well.
It's a great question. And I think the first thing and most important is you do have to know yourself and know how much you can handle, because you have to know what you're signing yourself up for. Again, this goes back to your experience as a dietitian, and you're talking to people and finding out what you're about to sign up for. I knew exactly what being a PA was and what PA school would be like because of the conversations that I had as a dietitian with PAs and with other professionals. And so that is the first and most important thing, is you have to know yourself, know how much you can handle. And number two, you have to know what you're signing up for. If you think it's going to be like easy and, oh, I can still work and do it, you can't. Like, it is really, really hard. I'm a realist and I will shoot it to you straight. It is hard. So you have to know what you're signing up for. I also think having a community of support is really important. I also was a single mom in PA school. So I was married in college, had my daughter, and then got divorced. And then as I went to PA school, I'm a single mom. So add that to a layer of like impossibilities. And you could still do it. All right. So if you're a single mom, I'm here to tell you, you could do it too. But you have to have support, whether you're married, your husband or your spouse has to be on board, because the commitment is massive. You also have to have some kind of financial stability. I took crazy loans out and I have to have so much money to pay back. But if you have a spouse who's bringing in money, you're not going to be working. You literally cannot. I thought I would be able to like keep some clients, and no, you can't. So you have to have financial support. You also have to have, that mental capacity to be able to handle what's going on. But I also was very intentional with what I wanted to do, at how I wanted to still remain a really involved mom to my daughter. I did not want her to feel like she got the back burner because mom is doing mom now. That was a priority number one. And I committed to that. And so what that looked like was, thankfully also, I'll give you a little context. She was going into kindergarten when I started PA school. So she was in school. So she wasn't a toddler at home. So that did help a little bit. So I also have family who live very nearby. But if you don't have family, hire a nanny or a granny or something like that can help you. But my mom would take her and pick her up from school because we kind of left at the same time. The school times and days were about the same. And so that worked really, really nicely for me. But when I picked her up from school, it was mommy and me time. I never, ever, ever multitasked. I always gave her my full attention. And then when she went to bed, also thankfully she was little, so she went to bed at like 7:30. It was go time for school. I didn't multitask on anything else. So I had a set, solid 4 to 5 hours every night to set aside to studying. And honestly, that was really helpful because then you're not distracted. You literally know like, okay, I have this time or no time. So I'm going to make the best of it. So I think prioritizing your time is another skill that has to be learned, but also perfected if you want to be successful in PA school, because if you're a parent, you've got limited time. It's just the truth. And to be honest, I was not top of my class. I didn't study as much as the other students did, but I was okay with that because I watched my daughter. I went to every ballet, concert that she had. I was able to go to her tea sessions. I didn't stay after school to study with my friends. So I really didn't make great friends and connections like a lot of the other students did. So I had to sacrifice some of the social aspect of things, but that was my choice. And I did that intentionally because I did not want to sacrifice my relationship with my daughter. And it's proof now. We have an amazing relationship, and she's like probably my number one fan. She's so proud of me.
I am so glad that you shared. And first, thank you so much for sharing that aspect because it's a very personal part of someone's life, especially going through a transition like that from being the RD to PA school and how difficult that was. And I can just attest, my mom, she did the similar thing. She went to become a physical therapist assistant, and I graduated with my associate's degree the same year that she graduated with her associate's degree. So we were able to walk together on the stage, and it's a feeling like that. You can't replace it with anything else. And so I in having stories like that to share with other people is so invaluable because if someone feels like they're alone and they feel like they don't have support and they feel like they don't know where to start, like it is personal experiences and personal stories from that is the best piece of advice anyone can get, especially if they're trying to transition or they don't know where to get support or they don't know how to start. So it's super invaluable what you shared. And again, the focus on intention of yes, you had to make sacrifices, but you knew what you were getting into. You knew what you were sacrificing, and it was a calculated risk. And it wasn't just, you decided to flip a coin, heads, PA school, tails, staying as an RD. It was definitely intentional. You did your research. And because of that intention, you were able to get everything that you planned for out of it. You were able to keep that relationship with your daughter because you were intentional with your daughter. You were able to pass PA school and become a PA because you were intentional with studying. And all of those things, even though if you see on paper, like being a single mom, going through PA school, like all of these things, it's like, how did she do it? Being honest, being transparent, that is super helpful with other people who may want to go down that path. And again, like, thank you very, very much. Because yeah, we always want to emphasize those stories because we've had many a guests before that are single moms or like we're single moms going through, and we really do want to highlight that it is possible. You can do it with intention and with knowing what you're getting into. And going more into like your work as a PA, like after you were able to graduate and get into that work and really push the limits of what you wanted to do in your practice. You said that you have been and have worked in pediatrics since you've become a PA, even as an RDN, all that stuff. And you mentioned before the recording, and this is also a topic near and dear to my heart, is like adolescents and with your experience with them, adolescents and discussing like weight and how weight stigma is now and just how it is definitely a delicate topic for that population. And it's definitely an important topic because you're dealing with, now more than ever, there's a rise in adolescent obesity, but there's also the rise in weight stigma, negative self-esteem towards weight. Like there's so many different factors that are playing into the topic of weight, especially at a young age. And like I've personally experienced it. I'm sure multiple people have experienced it throughout their life in the medical space, the topic of weight, how it's addressed. And I just would love to hear your perspective and your experience with approaching it with both the nutrition aspect, the foundations as a dietitian, and the things that we're taught, and how you've translated it into the medical space where it's very like treatment first instead of like it's very symptom based instead of root based. And with a topic like adolescent obesity or just weight in general, it is definitely difficult to treat based off of symptoms. And so I would just really love if you could share just your experience, what got you into this space and recognizing it as something that needs to be addressed.
Oh, Jenna, this is a topic that is so near and dear to my heart. I'm just like you, so passionate about this. And It's actually happened over time, because until I was a PA and actually having face-to-face conversations with kids and families, I really didn't know that it was such a big issue as it is. And unfortunately, providers, and this is not to single out doctors, PAs, or nurse practitioners, all of us handle the topic of weight in children wrong. And we get it wrong so often. And unfortunately, it's at the detriment of the children. Every single day, I have had patients and parents tell me that the previous clinician made the patient feel fat, made the patient embarrassed, told the patient they need to lose weight, made fun of their chubby, quote, belly, told them that they're never going to get a date for prom, told them that, or on the reverse, they need to put some meat on their bones, they're too scrawny, right? So the conversations that clinicians have around weight with kids is so inappropriate and harmful. And I will stand on my mountain shouting this conversation probably until my last breath, because I see how harmful it is, because I watch the child's body language when the mom is sharing this story with me, because I hear how they cried and weighed themselves for months because the doctor told them they need to lose weight. These are real stories. I mean, this was a 10-year-old boy who I saw for a sick visit. It wasn't even a checkup, but I walked in and he's crying already, which in pediatrics is normal. They think they're getting shots, so they cry when we come in. But he wasn't. He was there for like a rash. And so I paused and I said, "What is going on? Why is he crying, Mom?" And she told me the story of that the last time he was here 6 months ago. The clinician told him he has to lose 10 pounds before his next visit. Mind you, he's 10 years old. He's going to gain weight. He's pre-puberty. They get a little chunkier and a little heftier. They grow out before they grow up. This is normal physiology. We should know this. And she had said that he had been eating less, measuring his food, and weighing himself multiple times a day. And that when he stepped on the scale in the office today, that clinic day, he immediately cried because he put on 3 pounds and didn't lose 10 pounds. And he knew that he was going to get scolded by the doctor because he didn't meet those goals. I was crushed for this little child. I don't cry easily. You're in medicine, you get really tough skin. I almost cried watching this little boy and looking at his body language, hearing this story. And it is not the only one. I hear this story all the time. I had a 14-year-old girl whose mom said that they were so thankful for the way that I approached talking about her weight, because everyone prior to had just labeled her and literally said to her that she's obese, she's going to get diabetes, and she's going to need to go on medication if she doesn't lose weight. And I just think that we need to reframe how we're having these conversations. It's not an appropriate time and place to tell a child that they need to lose weight. People will push back on this with me. And I've had a few clinician colleagues of mine tell me that that's not appropriate. And I disagree, because a child shouldn't be focusing on their weight. A child should be focusing on having fun and moving their body and eating foods that nourish their body and help them do well in school and run faster and jump higher. If they do those things, their weight will follow. You don't have to tell them that they should focus on their weight. It is a secondary side effect of following our quote guidelines of healthy eating and activity, right? And so I feel as though clinicians shouldn't even address the topic of weight around a child. If the parent wants to know, which they often do, half the time they come in and say, "Oh, I'm really concerned with his weight." And what I do, I immediately look at the child. Their body language tells you everything about what they feel about this conversation. Most of the time, their shoulders are slumped. They don't make eye contact. Because guess what? If they are overweight, because yes, this is a real problem. I am not in denial. I am not a person that brushes over this at all. I think it puts them at risk for a lot of medical conditions, including psychological and mental conditions. However, if you're overweight, news flash, you kind of know you're overweight. You don't need someone to tell you that you are in a bigger body. I don't know where in society it's become a clinician's responsibility to say, "Oh, well, you're in the overweight or the obese range today." I'm sorry, but kids are really observant at this age, and they already know that they're larger than their student, and their friends. You don't need to go into that. You don't need to do that. And so what I like to focus on are their dietary habits, because they didn't get to be overweight or morbidly obese, which we do have a lot of children who are. They didn't get that way from following a healthy diet. I guarantee it, right? And genetics play a role as well too. If you've got a kid who is 12 and he's 250 pounds, probably the parents are struggling with their weight as well too. We've got a lot to do with genetics and obesity in this space that we're in right now. And so it's not the child's fault half the time. It's just the environment that they're in. So shaming them and blaming them and telling them that, oh, you just have to eat better and don't eat any sweets and stop eating white foods. All these conversations that we're having are not helpful. And so the way I like to reframe it is just that. I like to have curious questions, and I love to focus on fruits and vegetables, because if we can get our kids to eat more fruits and vegetables, I promise you over time, their weight will follow.
I'm first going to say I wish I had you as a PA whenever I was growing up, because I am just as passionate as you are about the subject, because I wouldn't be pursuing dietetics if, again, it's a catch-22. Had I not had a negative experience in adolescence being told that I was obese, like, I wouldn't be where I am today, and I'm grateful for where I am, but for me to be where I am, I didn't need to, and same with any other child. They don't need to have those conversations. And I absolutely agree with you, because I feel like where the current space is when it comes to addressing that concern is it's a focus on deprivation instead of abundance, where, again, adding fruits and vegetables, adding movement, adding these things to their lives instead of taking away, because it is so much, and again, like, it is natural for the development cycle for children to gain weight first and then grow. And everyone's different in their rate. And again, depending on their environment, they see themselves different. And I feel like for children, and I'm not saying this for all clinicians, of course, but I've certainly, just with talking to children in general, I've not just about the topic of weight, but just in general, we forget that they have thoughts, they have self-perceptions, they are independently thinking about their perception of themselves, how others think of them, how they're portrayed. They are super aware, and especially if they're in a bigger body and if they're heavier, they're even more aware than the average kid. And so that makes it even more important for that population on how you address it. And I could hear the passion in you describing it, and I'm so glad that you have that passion, especially where, with statistics showing an increase in adolescent obesity, there's that concern where there's going to be that pushback, that negative pushback even more. And it's really important to push back against that pushback and focus more on the adding fruits and vegetables, adding movement. And I'm glad that you emphasize that if the parent wants to know, to talk with the parent, because the kid, like, they are being raised in whatever environment they're subjected to. They didn't choose whether or not their house had fruits, like accessible healthy foods or ultra processed foods on hand. And it is mainly the parent being, not the parent or whatever caregiver that they have, and the environment that they're in that influences the outcomes and things like that. And so I'm just really glad that you're in that space and you're really pushing towards it. And I think my biggest passion or emphasis on this topic is advice that you have, because I feel like a lot of aspiring dietitians, they have the same sentiment, or people going into the nutrition space, a lot of us have that sentiment where we want to promote health in an inclusive, very sensitive, and very accommodating way based off of people's backgrounds, genetics, with everything involved. But again, then we have the side of healthcare where it's very symptom treatment based rather than root cause, where are they coming from based. And so for people who are aspiring to become a dietitian or just entering this healthcare space, do you have any advice, especially for aspiring RDs? And do you feel like, so say that an aspiring dietitian is like, okay, I don't know if I want to become a PA the PA yet, and I don't know if I'll be the practitioner coming in and actually having that patient contact. How do you think us, like RD2Bs, aspiring RDs, can help uplift this message without, in case we're not the PA or have that PA credential or have any nurse practitioner, doctor credential behind us to be able to talk to those patients face to face? Because what advice would you have for us to help uplift the conversation?
Okay, before I answer that, I wanted to just remind listeners that something important that you had said, that the child didn't choose where they're from, where their upbringing is. And this is a really important fact that people forget when you're sitting there staring at a 250-pound 10-year-old, right? I mean, this is the reality. Some of these kids are in very large bodies and are really struggling with childhood obesity. However, saying to that child, you need to eat more fruits and vegetables, probably that's a great statement and you mean well in that statement. However, I push clinicians further. I always tell them you need to get to know your patient. You have to know what is going on at home. Because as an example, I caught myself, I had said this, I was actually rushing and I'm like, okay, let's focus on some more fruits and vegetables. The child looked at me and he said, well, it's going to be a little bit difficult because we've been living in our van for 2 weeks. Just like that. And looked at me right in my face. And I like was floored. I took a step back because I'm like, okay, they have some serious, real social economic concerns going on that me, rudely was not aware of. I didn't ask about. And so I tell clinicians all the time, like, you need to find out if they even have the financial ability to purchase the foods that you're telling them to eat. And if they're struggling, give them those resources. Or maybe have maybe 1 or 2 fruits and veggies off the top of your head that are really inexpensive, or places that they can go, food banks. Give them resources to achieve the outcomes that you're hoping for them to achieve. And because I think that you have to start there. You cannot just blanketly tell people, oh, you can't have chips anymore. Well, you know what? Sometimes chips are the only meal a child has had. And so we have to be really sensitive in blaming and shaming children, because a lot of the time it's out of their control. All right. So moving on to what your question was, I think it's really important for all people, but especially kids, to know that their identity is not found in their weight. And whether that's a higher body weight or a lower body weight, because I have kids and patients on both ends of the spectrum, and it's a really big struggle for them on either side. And their identity and their love, their ability to be loved and to love, is not affected and is not a result of what they weigh. And I think that that's a really important thing that you say out loud to a child, because they usually do feel really embarrassed. They usually do feel really ashamed of themselves if they're not at that quote perfect body weight. So reminding them that they're awesome and they're cool kids and they're smart and they're neat and you would love to be their friend, whether they stay at this body size, they go bigger or go smaller, they're still really, really cool. But you just want to help them love themselves and feed their body so it can thrive. I think that's a really important place to start. But as a, if you're just an RD2B and you're like, well, I don't know, I can't really impact people. Yes, you can. And I think it starts with your family and the people around you. You might not be seeing patients yet, but I mean, kind of you are, right? If people are like, you're in college for nutrition, literally they have like a million things to say to you. And so I find that the most harmful conversations to kids happen from their family members, which is really, really sad. But a lot of times the parents will come in and be like, oh, doctor, you need to put her on a diet. The girl is 6 years old, like, no, she doesn't. And then again, I look at the child and they're just like, I don't know, they don't know how to respond to that. Same with the quote title of picky eater. Oh, he's just such a picky eater. And kids get really offended when you label them that. They're like, oh, no, I'm not, so I think reframing our language that we have with our friends and our family members, and never even bringing up a person's weight in front of them. I don't know where in society we think it's our right to comment about someone else's weight or the foods that they eat. It's not. It's never our right to do that and to judge someone for the foods that they choose to eat, what their body looks like at all. But I think that you can have fantastic conversations with your family And I think corrective conversations, you might be having more than, educational conversations. Even I've had people, will make comments about my daughter. She's actually quite thin genetically. She's just always been on the skinnier side, and she's really tall. So she's like a string bean right now going into the preteen age, that awkward phase a little bit. People comment, "Oh, you're so skinny. Don't you eat enough?" And she's like, "Mom, this is getting really annoying." And so I stepped in. I was like, "Hey, you know what? We're not going to make any comments about her body today. Let's talk about something else." And just that statement alone, she felt so heard and supported, and like someone's got her, that I think that meant more to her than anything else I could have done. So just be really aware of conversations that are happening around you about food or body weight, and correct it and or give correct information. Also, I would recommend every dietitian to be, get your butt on social media. Be on LinkedIn, be on Instagram, be on TikTok, pick one, I don't care. Get on there and share appropriate information, because the amount of like quote nutrition gurus on there drive me absolutely insane with the crazy stuff that they're spreading. And the more and the louder those people's voices are, and we don't kind of bite back, the more we will be shut down and the more we will be shut out. And I feel as though like my generation and or the older generation, they didn't have to deal with this as much because social media wasn't really a thing, 10, 15 years ago. Now it is. And so a lot of people are resorting to get their nutrition information from social media. So why not get on there? Use that as your microphone. You can impact hundreds of thousands of people just being a nutrition student, and way more ways than I ever did as a nutrition student. So if you're not on Instagram or TikTok or whatever, get on there and share factual information and share what a dietitian is. I think that is so important, and why we are termed and coined the nutrition experts, because that message has to be spread to the world if we want to gain the respect that we want.
Absolutely. And I think it's honestly, there's a lot of emphasis on, because I feel like what people struggle with is, okay, but how do I do it? It's really like, I feel like we get bogged down by the how and not like just do. Like in any capacity that you can, just get the word out there, whether it's letting your neighbor know what a dietitian is, or having an Instagram account where you just kind of uplift what a dietitian is, or if you're recently graduated, if you not recently graduated, but if you recently get the RD credential and you're a practicing RD and you're on an interdisciplinary team, to be like, this is who I am, this is what I do, and like educating everyone around you as to what role you play. Because I think this is just like my personal perspective towards especially RDs in clinical settings is like, yes, there are going to be those people that just see you as a lunch lady, but you have to be no one's going to correct them if you don't. Like if anyone's going to let them know that you're not the lunch lady, it has to be you. And whenever it comes to making your voice heard, it typically has to start with you. And in any capacity, whether you're going through your dietetic school or you are an RD, or then you decide to become a PA, advocacy towards yourself and your role is important no matter where you are. And it does play true to social media and leveraging that, because I mean, social media is not going away anytime soon. Like it's, and it's definitely, it's going to be there. And so it's the matter of making the best of it with, again, uplifting correct information and educating people on, dietitians and how to, like with what you're doing, for example, with talking about weight with adolescents and pediatrics and what you're doing, like the emphasis should be just getting the message out there in whichever way is best for you. And I think you've just brought up so many good points and just so many great things, either whenever it came to choosing dietetics, pursuing PA school, being a PA, how you talk about weight with pediatrics, and then also like that balance of letting the listeners know being a dietitian is awesome. There's a lot of awesome things that we can do. And that being a PA it's more so, again, like you chose to do it not because you didn't like being a dietitian, but because you wanted to push your boundaries of what you were doing and you wanted to increase your scope as to what you could do. And so the main, I guess, like final question or just discussion point that I kind of want to cover is if someone is interested in or is an aspiring RD, wants to become an RD, but they might feel limited by being an RD, especially just with all the things going around, and they're just not really feeling empowered because we've seen with statistics the decline of admissions for students in dietetics programs, and there doesn't seem to be as much incentive because of the pay, master's degree requirement, and things like that. But do you have any words of advice, pieces of wisdom with your experience to kind of empower aspiring RDs to pursue that credential? And also, like, your final thoughts whenever it comes to having the PA and what it means, like the PA credential and what it means for you. I know that's a big loaded question. It's mainly kind of the emphasis on advice and things to inspire aspiring RDs, and then to kind of bring back the purpose as to why you got the PA credential and who it would work for with what you'd want to do versus who it would not work for.
It's a great question, because what I don't want someone to do is jump ship from their dream of becoming a dietitian to thinking that being a PA is so much better, because we have the same, actually, interestingly, the same struggles as a dietitian, right? Like, some people want to be like, oh, you think you're a fake doctor, or we actually get paid a little bit less in some specialties than nurse practitioners. And so there is still that like wrestling or that tension with the PA degree. It's not all roses. I mean, doctors get paid twice as much for the same job that I'm doing, right? That's really frustrating. Some people are like, well, what's a PA? Am I going to see the doctor? No, right? Like, you still have to explain what a PA is. So just like you have to explain what a dietitian is. So don't think that the grass is greener on the other side of not becoming a dietitian. I also think that now is the best time to become a dietitian, because things are shifting. The culture is moving. The culture is frustrated, especially if you live in the United States. We're really irritated with westernized medicine. We're irritated with our food companies and the food processing. People are becoming outspoken. They want healthier foods. They want preventative medicine. So obesity treatment is huge right now with the formulation of medications. So if this is like a prime real estate to be a nutrition professional, because the opportunities now and honestly within the next 5 to 10 years are going to explode, because we need dietitians. And it's not just in clinical practice. We need more private practice dietitians. We need more pediatric dietitians. We need more media dietitians. I mean, even if you're a student, you can write nutrition blogs. You can get paid to write. That's actually what I did. That's how I started. That's how I got great connections. I was a little assistant making like $12 an hour for a super famous back in the day dietitian named Nancy Collins, who ran nutrition411.com. And she's like the queen of wound healing. And so don't give up on becoming a dietitian because of you have to get a master's degree. I'm honestly, like, what profession in medicine doesn't need an advanced degree? Realistically, dietetics is behind on that. Most of the professions need a master's degree, and some are even getting doctorates. Even PAs, a lot of PAs are now getting their doctorate, which is like unbelievable, right? And with the amount of schooling that we had, some are even getting advanced credentials. And so don't let that hold you back. Don't let reimbursement and pay hold you back. You can create a really, really, really powerful, financially wonderful career as a dietitian. I did not leave dietetics because I wanted to make more money. You don't make that much more money as a PA. I'm in pediatrics. I chose the like lowest reimbursement PA career. Maybe if it went into dermatology or plastic surgery or something, it's different. I followed my passion. And if I can leave you with anything, I would just say, follow your passion. Don't pay attention to the setbacks and the barriers. If you're passionate about teaching people about nutrition and helping them live the most vibrant life, go for it. attack it and don't let anything hold you back from that, because you will impact so many people, and the fulfillment that you will have from becoming who you want to become is unlike anything else. So I would say now is the best time to become a dietitian.
Wow. And I'm really glad that we ended on that note, just because I think talking about your experiences and how you were a go-getter and you just kept progressing towards the things that you wanted to do because it was what you wanted to do to help progress, not just nutrition, but also getting that PA credential as well. Colleen, thank you so much for taking the time to sit with us to talk about all your experiences, the wonderful advice you have. And I really, truly believe that anyone listening will be empowered or inspired by at least one aspect of this conversation. So again, thank you so much.
Jenna, thanks so much for having me. This was really fun.
Awesome.